Good morning to all. Today I am going to present on a topic called radiographic anatomical landmarks of mandible. So first, when we look upon the synopsis of this presentation, we have introduction, radio-opaque structures, radiolucent structure, mandibular incisor region, mandibular premolar region, mandibular molar region, clinical importance and references. So based on the absorption of X-rays, we classify the intraoral structures into radio-opaque and radiolucent structures, and based on the region where it is present in the intraoral region, we classify into mandibular incisor region, mandibular premolar region, mandibular molar region. So starting up with an introduction, knowledge of the radiographic appearance of normal structures is the foundation of radiologic interpretation. The radiographic appearance of structures reflects the pattern of X-ray photon attenuation. Tissues that attenuate more photons appear more radio-opaque, whereas low attenuation of tissues appear radiolucent. In viewing these images, a clinician should combine the information on the X-ray beam angulation with knowledge of anatomy and decipher the projections and positions of individual tooth structures. CT images provide visualization of image anatomy in 3 dimensions without superimposition. When viewing the individual tooth, image may be oriented to along the long axis of individual root. Next comes the radio-opaque structures of the mandible. Geniotubercles, mental ridge, mylohyoid ridge, external oblique ridge, inferior border of mandible, coronoid process. The radiolucent structures are symphysis, lingual foramen, mental fossa, mental foramen, nutrient canal, submandibular gland fossa, mandibular canal. When we look upon the mandibular incisor region, the structures present are symphysis, genial tubercles, lingual foramen, mental ridge and mental fossa. The mandibular premolar region consists of only one structure, that is mental foramen, which appear as radiolucent, ill-defined area between the area of bicuspids. At last is the mandibular molar region. Mandibular canal, submandibular gland fossa, mylohyoid ridge, inferior border of mandible, coronoid process, external oblique ridge, nutrient canals. The picture shown on the right side is the mandibular canal. In the upcoming slides, we are going to see about a little description about the above mentioned structures. Symphysis. It is normally present in infants of 1 year of age. It demonstrates a radiolucent line through the midline of the jaw between the images of the forming deciduous central incisors. If this translucency is found in older individuals, it is abnormal and may suggest a fracture or cleft. Genial tubercles, also called mental spine, they appear as radio-opaque, 3 to 4 mm in diameter on the lingual surface of the mandible in the midline below the incisor roots. Lingual foramen, radiolucent hole in the center of genial tubercle, usually surrounded by radio-opaque structures. Lingual nutrient vessels pass through this foramen. Mental ridge, they may be occasionally seen as 2 radio-opaque lines below the apices of mandibular incisor roots. Mental fossa, it is seen as radiolucent area with ill-defined borders in the region of incisor roots. It is a depression on the anterior surface of the mandible. The first IOPA picture shown here is symphysis, where you can see a dark line which is a radiolucent line. Second one is your genial tubercle, which is also called mental spine, where you can see a triangular-like structure which is a radio-opaque structure, so it appears white in color. Third one is your lingual foramen, and fourth one is your mental ridge. In fifth one, where the arrows are indicating the mental fossa. Then mandibular canal, it is a radiolucent structure. It appears as dark line shadow with thin radio-opaque superior and inferior borders, arises at the mandibular foramen on the lingual side of the ramus. Submandibular gland fossa appear as a zone of translucency below the lower molars. Mylohyoid ridge, also called as internal oblique ridge, extends from third molar to second premolar region, appear as radio-opaque. Inferior border of mandible, it is seen on periapical projections as a characteristically dense, broad, radio-opaque band of bone. Coronoid process, appear as a triangular radio-opacity. It is apparently seen on periapical radiograph of maxillary molar region. External oblique ridge, it appears as radio-opaque line which usually ends anteriorly in the area of first molar. Nutrient canals appear as radiolucent lines of fairly uniform width, most often seen on periapical radiograph of mandible, running vertically from an inferior dental canal directly into the apex of the tooth. The first picture shown here is submandibular gland fossa, mylohyoid ridge is the second picture, inferior border of mandible is the next one, coronoid process is the fourth one, external oblique ridge is the fifth one, nutrient canals is the last one. When we step into the clinical importance, it helps to avoid misdiagnosis. On periapical radiograph of mental foramen, periapical lesions can be found, vital for surgical planning and implant replacement. It is useful to recognize pathologies. If symphysis is found in older individuals, it may represent a fracture or cleft. The references I have taken for this presentation is White and Farrer's Oral Radiology, Principles and Interpretation, latest edition, Burkitt's Oral Medicine, 12th edition. Thank you.